Now what are the commonly used drugs? The commonly used drugs are all short acting agents like Midazolam, Alprazolam and Chloral Hydrate. Now what are the routes through which we give it to these patients? So most of them are given per orally, especially Alprazolam. So this is given the night before surgery, and Midazolam can be given IV. Most of the times we give it IV, or we mix it with some solutions and we can give it per orally also in the patient. We can give it IM also, but that is very painful. So these are all the routes. The best pre-medicant anxiolytic is Midaz because it's very short acting, and within the time that the patient becomes depressed and he starts getting sedated and the respiration stops, suddenly there will be a rise in the carbon dioxide levels in the patient's body and there will be stimulation of respiration and the patient will wake up. If you give a long acting benzodiazepine like Lorazepam or Diazepam, then this respiratory depression gets prolonged in the patient. Now anxiolytics are contraindicated, as I told you, in any patients with CNS pathology, any patients with allergy, any patients in whom you have anticipated difficult airway, and patients with risk of aspiration. Okay. So anticipated difficult airway, suppose patient gets over sedated with the anxiolysis, then in that case he will just go off to, it will become difficult to secure his airway. And risk of aspiration, if patient is having full stomach and you give him anxiolysis, and that leads to opening up of the lower esophageal sphincter and the food can enter into the esophagus. Now if this patient is slightly sedated, he won't be having the protective laryngeal reflex, so he will get pulmonary aspiration.